Well, over the past few days, the world has been talking about hospice care. This following former President Jimmy Carter entering hospice at the age of 98. A statement from the Carter Center says he's decided to spend his remaining time at home with his family and receive hospice care instead of additional medical intervention. So with us to talk about it today is Dr. Payal Kohli, our 9 Health medical expert. Obviously, this is a very sad time for families to address hospice care because it is clearly the end for people. But tell us a little bit about what hospice care entails.
You know, hospice care is really a shift in the philosophy of care. So often in medical care, we think about cure. We think about prolonging the quantity of somebody's life. But hospice is really sort of shifting that and saying, let's not focus on quantity, let's focus on quality, even if it means compromising the quantity. So it's somebody who, is within 6 months of the end of their life, and you're really helping them sort of spend the time doing the things that they love to do spiritually, emotionally, and physically.
And that can be vastly different for every family, for every individual. I think you hope that the individual at this time is in command, that they understand where they are and what they're doing, but not everyone gets to make that choice.
No, but it should really be a decision, not just from the care team top down, but from the family and the individual as well, because it's their values. It's giving them dignity at the end of their life, and if it's patients that have conditions like dementia or advanced lung disease, advanced heart disease, kidney disease, on dialysis, and for them the effort spent to continue living sometimes is more than just being able to spend their time not going to medical appointments but with their families.
So is this, do you, besides families talking about this and making the right decision, the blessing too, like in former President Carter's case, is he's saying, I want to be at home. I don't want to be in a hospital setting.
That's the wonderful thing about hospice. It's really trying to help the person die where they want to die, on their terms, not letting the disease dictate that, not letting the medical system do that, but allowing them to be surrounded by their friends, their family, allowing them to be comfortable, thinking less about how many pills they have to take, more about memories and sort of celebration of their life.
What about those people and those entities that deliver hospice care? That's a unique group, and I imagine a very talented group in a very different way.
Talented and incredible people, and I think that they make it the purpose of their life to bring the top discoveries in medical care to somebody's bedside. And now that can be at home, it can also be in a hospice facility, it can be in the hospital, so you can really choose where you want to get hospice. You can choose what your hospice plan looks like, you and your family members. Does that include a lot of medications? Does that include IV fluids? Does that include only sort of comfort medications for pain? So it's very individualized to that individual. Then there's also the spiritual team members, there's also social workers. It's a whole team of individuals that bring to you exactly what you're looking for.
And there's a difference between palliative and hospice. Many people, I think, don't understand that.
There is. So palliative care is kind of an umbrella term. Now, palliative care can still include curative treatments. So, for example, if you have cancer and you're getting chemotherapy, radiation, and surgery, you can still be part of palliative care, where there's still the central focus is on comfort rather than quantity of life. But when you do hospice, you're really sort of within 6 months, and it's not about cure at all. You really shifted the focus completely. Oftentimes we'll discontinue medications. In fact, hospice patients take less medications than others, and these are medicines like, for example, statins that prevent a heart attack in 5 or 10 years. Those are not medicines that you would benefit from. But we'll continue other medicines like blood pressure medicines, because if we were to stop those, you would feel bad.
When we hear of someone going into hospice care, we presume the end is near. Is there a natural window there? Is it a week? Is it a month? Is it 6 months? Is there one size that not fits all, but fits most?
It's widely variable. Some people actually will go into hospice and come back out of it too. That sometimes happens if their disease gets better. But for the most part, the majority of people usually pass within about 3 weeks or so. And then there's a third of people that'll pass within a week or so.
Well, it's a very tough topic to talk about when it involves you or your family or someone that we know so well, as in the case of President Carter. Knowing a little bit more about it might help some people as they start to plan or look down the road or think of what they might want to see in their future. So it's always good to talk to you about this. Normally we're talking about cures and things. Today, a little bit of a tougher topic.
Yeah.
Thanks. Dr. Payal Kohli. We'll be right back.